Hey guys, it's Dr. Klein here. I'm just going to be talking to you guys about some lateral knee pain today. If you're having pain coming from the IT band here and what you can do about it. So before I jump into the exercises, I just want to talk a little bit about what causes this lateral knee pain. A lot of times this can be caused by a rapid increase in training load, whether it's running, walking, or whatever your sport is, especially if you're introducing a lot of the downhill mileage. A lot of times if we have some weakness in this hip muscle or we're overstriding with our running or walking, that can create some of that knee pain down in this area. So let's jump into some exercises that you can do from home. So some initial exercises you can do for this condition when you're in that acute phase are some single leg bridges and some strengthening of the gluteus medius. So I'm gonna run you through some of these here. The first exercise is going to be a single leg bridge. You're going to lay on your back and bring one knee to your chest. In this instance, your left leg would be the one that's bothering you. So you're hugging your right knee to your chest, bringing your hips into the air, and then coming back down. You can repeat this exercise about 10 to 12 times, and then a nice 2-second hold at the top, and rest there. The next exercise here is a progression of gluteus medius strengthening. So the first phase of that strengthening would be having this top leg straight. In this instance, we're assuming the right side has the pain. So you're bringing that right leg back and up at about a 45-degree angle and just holding here until we get some fatigue, and then we're going to come back down. Usually doing about 3 or 4 sets of 20 to 30-second holds is good. Once you're able to tolerate that, then we want to come into a side plank. A lot of times in a side plank from the knee is most tolerable, and then we're adding in that leg raise with the top leg here. This is really going to strengthen both sides, so we're getting some good strengthening on each side. Again, a 20 to 30-second hold is good, and once you're able to do this exercise, we'll want to do both sides. So you'll do it on the right leg on the bottom and the left leg on the bottom. So you would know you're ready to advance to the side plank position once this initial position is tolerated fairly comfortably. You're not having any pain with this. You're able to run pain-free, and you can maintain that top position for that 20 to 30-second hold for 3 sets. Once you're able to do that, we'll want to progress the difficulty to the side plank with the leg raise. A lot of my patients ask me about foam rolling for the IT band. The IT band tends to be a compression issue, so it's usually compression of the band over some fat tissue here gives you some of the pain. So foam rolling down in this area is usually just going to increase your pain. What you can do instead is grab a foam roller, or I prefer a softball or a lacrosse ball, and find the gluteus medius up in here and the tensor fasciae latae right between that hip bone and the pelvic bone there, and just roll over that muscle there. So you can just hold here, find some soft spots, and give those an extra love for a few minutes. And then come onto the side of the hip there, right between the hip bone and pelvic bone there, and spend some time up there also, because that's the muscle that directly turns into that IT band. The last phase of exercise we'll want to add in is some split squats. You're ready for this when you can go downstairs without pain, when you're able to run downhill without pain. So what you'll want to do here is bring the leg back onto a low height at first, and we're just gonna squat down and back up as low as you can. We wanna do this on both sides, and the trick is you want to load the painful leg each time. So if the right leg is painful, we're gonna shift the weight slightly over that leg when we come down and back up. And then when the right leg comes back, we're still shifting the weight back onto that right leg as we come down and back up. As that's tolerated more and more, you can raise the height that you're doing it from, so like a higher chair or your couch. And then if you have weights at home, we really want to add some weights to this. And with this, what you want is to be at a slight forward lean, and you want your trunk angle, so the angle from your hips and your chest, to match the angle that your foot and ankle are making with your knee. So a slight forward angle on both spots. The knee can go right over the toes there, and that should be good. To start, you can do 3 to 4 sets of 10 to 12. Once you add weight, we want to make it a little heavier, so 3 to 4 sets of 6 to 8 is good. If you're having pain with that exercise, what you can try is lowering the height of the surface that your back leg is on, so regressing slightly to how we first started. If that's still hurting, you can see if your knee is coming really far forward. That's not necessarily a bad thing, but it could be causing knee pain just by increasing the force to a level that the knee isn't quite ready for. So try out those things. If you're still having pain, it might be time to come in and see your physical therapist in your area. We'll see you guys next week.